Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Falls, Prevention and Recovery, presented by Alisa Curry, physical therapist with Washington Hospital Healthcare System. Alisa is the coordinator of rehab clinical programs at Washington Hospital. She is a board-certified clinical specialist in geriatric physical therapy. Alisa has dedicated her entire career to improving the care of the geriatric patient population, committing to a more efficient, patient-centered, functional, and humanistic approach. Please welcome Alisa Curry.
Hi, I'm Alisa Curry, and thank you for having me. I'd like to talk to you today about falls, fall prevention, and fall recovery. My goal is always to make sure that people have practical advice that they can take away and use today. So anything in this presentation you should be able to employ in your daily activities. Just keep in mind that the goal for everyone is to find out where you start and to continue to try to improve. Our goals for this program are to identify the need for mobility, its importance, the factors that can contribute to things like falls, strategies that you can use to apply to both fall prevention and recovery, to work on things like stretching and movement exercises, which are not complicated. They actually are just meant to get you started. We also want to recognize some techniques in fall recovery, and finally, we want to promote some community resources around safety and maximizing your overall function. Now, as you can see by this GIF, we all fall. I've fallen. I have 3 degrees and I have fallen down. It's important to understand that regardless of where you fall, how you fall, why you fall, we want to try to do better the next time. So it's important to recognize those things that are controllable factors. To look at the statistics from the Center for Disease Control, 1 out of 10 falls results in an injury that causes the older adult to restrict their activities for a day or more, or to seek attention from the healthcare system. There's 3 million emergency department visits due to older people falling. Each year, there are about 1 million fall-related hospitalizations among older adults. According to the CDC as well, in 2019 alone, 83% of hip fracture deaths and 88% of emergency department visits and hospitalizations for hip fractures were caused by falls. There's about 319,000 older people who are hospitalized for hip fractures, and falls are the most common cause of traumatic brain injuries. This is not specific to older adults. There are people who are not considered older adults that fall. However, combined with the aging process, it's important to understand that something that might be considered a minor fall for a younger adult or a middle-aged adult might actually be the precursor to a decline in physical health for the older adult. These are some of the factors that are related to falls. These are factors that you cannot control. You can't control your age. Just because you're older, though, don't assume that you're going to automatically fall. There are plenty of people over the age of 80 who are doing just fine and are not at fall risk. And there are plenty of people under the age of 80 that do as well. If you have a previous history of falls, you can be inclined to fall again. You can have physical dysfunctions like muscle weakness, gait or balance issues, poor vision. These are factors that can also contribute to falling. Things like medication usage that can cause changes in your blood pressure, or making transitions from sitting to standing or from lying down to sitting up. That's called postural hypotension. That can predispose someone to falls. There are also chronic conditions related to orthopedic, neurologic, and cardiac issues which can predispose someone to falling and put them at risk for fall. Probably the #1 reason that people can be at a higher risk of falling and experience more falls is because of an inherent fear of falling. It's very common that someone might say, well, if you're afraid to fall, don't get up. Well, if we could live our life sitting down, that would be great, but the reality is we can't. So we self-limit, or other people limit someone's ability to get up. And the problem is, the less you move, the more likely you are to develop weakness and to fall. There are also extrinsic factors, factors that are related to your environment, that are entirely controllable, that small changes can make a huge impact on limiting someone's potential for falling or fall. Things like a lack of handrails. Handrails are something that you can put up now very easily. You can hire a handyman or have a family member put handrails or grab bars in areas where you find that you need a grip. There can be a poor stair design. For example, stairs that can be slippery, stairs that can be not to code. You can have stairs that are exceptionally high that were nothing when you were younger, but now they're a little bit more difficult to navigate. Things like grab bars in the bathroom around not only the shower, but around a tub or near the toilet. That can be necessary to make that environment safer. Lighting is a huge issue. While low lighting is wonderful and sets a mood, unfortunately, as we get older, we actually need brighter lighting to help to decrease the amount of shadows or the problems that we can have with our eyesight in dimly lit environments. There are things like obstacles and tripping hazards that come from not just loose rugs and cords, but actually come from a collection of materials, things like stacks of papers or excessive furniture. If you take a look at your home environment, there's a time that you want to start decreasing the amount of furniture in your home environment to create room for not just assistive devices to use to keep you independent, but also it decreases the chance of you catching your foot or catching a leg on something. So it's a good idea to reevaluate and reassess the amount of furniture you actually need in your home environment. There are medications that you can be required to take, and it's the accumulation of medication effects that can actually predispose someone to falling. And then also factors like the use of an assistive device. I hate to tell you, but it's okay to use a walker or a cane or a four-wheel walker. It's okay because those are the devices that keep you independent. They don't make you look dependent. They don't make you look old. Anytime that you can be independent and upright, whether it's with or without a device, that's what's really important in life. It's to keep you moving. Your local pharmacist, as a matter of fact, can be one of your biggest allies in preventing your risk for falls. You have access to a pharmacist every day, and you have access to a pharmacist for free. The interesting thing about medications is that medications can have a cumulative effect. You can take medications in a similar drug category that can actually enhance the likelihood of falling. For example, medications that you might take for pain, for sleep, for anxiety, for spasm, those medications, and especially in those four muscle groups, or those four groups, can actually contribute to an increased risk for falls. So talking with a local pharmacist about those medications, how they interact, and what effect they might have on you is very important to your overall health. If you aren't sure about the medications and how they might impact you, it's important to discuss with your physician and also to discuss with your pharmacist. You can have physicians for many different reasons, and those physicians don't always speak with one another about the medications that they're prescribing when it comes to you. They may look at the list, but they may not truly evaluate the list and its effect. So it's always a good idea to make sure when you are using medications to, on a regular basis, consult with pharmacists and make sure that someone is advocating for your safety in terms of your physical health. Now, we want to talk next about how to fall. The most important thing about falling is these four factors. When you are falling, you actually want to try to stay relaxed. The last thing that you think about is whether or not you're going to get hurt when you fall. But the key thing to understand is that when you stay relaxed and you allow yourself to lean into the fall, to kind of tuck yourself and relax into it, you're less likely to try to brace yourself and possibly break a wrist, break an elbow, break an upper arm, or a hip. You want to always protect your head. So one of the best things that you can do is to cover your head or to put your hands near your head, because that'll just slow that secondary effect of falling and then your head kind of whiplashing into the ground or into something. If you have meat to land on, land on the meat. Some people can be very thin in their older years, and it's important to remember that your buttock and your side in some cases can be the meatiest part of your body. If you do have some let's call it soft tissue interference, you want to try to land on that, but it's important to remember, try to land on the more muscular surfaces. And the fourth piece of this is to keep falling. Don't allow yourself to fall and land, but remember when you were younger and you were a kid and you were running and you'd fall and you'd roll. Rolling is one of the best ways. I'll tell you a personal story. My father-in-law had Parkinson's and he loved to golf. He was an avid golfer all through his life. And as his Parkinson's started to get a little more challenging, walking on the uneven surface of grass was a bit of a deal. So we talked about how he would learn to fall, and I covered these things with him. And we went golfing one time, and he was, as he likes to say, he was in the most used area of the golf course. He was in the rough, and he took a swing, uneven, and he got off balance. And what he did is he took about 3 steps after he swung, and he fell, and he looked like his own stuntman by rolling through the grass. And we both laughed about it, but he said, you know, you taught me well. And so it's things like that you just have to remember. Everyone's going to fall. The key is not to get hurt. When you are on the ground, the first thing you want to do is a full systems check. Just like your car, all the lights light up when you first get in your car to start it. You want to evaluate, am I hurt? Is anything painful? If the only thing that's bruised is your pride, stay there for a minute. There is no problem with staying on the ground. The main thing that you want to assess is that if you have an injury. If you do, lay there, wait for someone to come, or if you do need to move, try to be as pain-free as possible by sliding yourself to a solid surface that maybe you can lean against and wait. If you assess that you are not hurt from a fall, you want to try to roll over and get to a solid piece of furniture. That way you can use that to come up onto a knee and hopefully get yourself up to your knees and to get your strong foot under you so that you can push up to that sitting surface and sit and take a second. The important part about falling is just realizing that if you didn't get hurt, it's okay to lay there for a few minutes, to collect yourself, to make a plan, and then to turn and start to get up. There are some situations where people actually fall and there's nothing around. And if that's the situation, you can roll over onto your stomach, you can push up onto all fours, and then I tell people to act like a 4-point pyramid and get their legs nice and wide. You can walk your buttocks up in the air and push up on your hands, and then use your hands on your knees to push yourself to upright. If you are injured, stay down. Don't be embarrassed. There are plenty of people that will help you, and they can also call 911. One of the hardest things to see is someone who's fallen outside on a hot sunny day and are laying there in the sun. But the best thing that we can do for someone like that is to roll up a towel or a jacket and put it under their head to stand and block the sun from their eyes, and then to wait for emergency services to come and help them. Don't feel like you immediately have to pull someone up off the ground, because you can actually cause more harm if someone actually is hurt. So don't be in a hurry to pick someone up before you do a full systems check to make sure that they're doing okay. A 2-person technique is the easiest to get someone up. And the easiest way to help someone up is to give them your hand and have them pull up on you. So you if you are the one that falls, you can stop everyone, tell them, wait a minute, let me tell you how to best help me. If you're the person who encounters the scene, stop, assess the situation. You can always wait for 911, make sure the patient's comfortable, and if you feel that you're in a situation where you can help someone, ask them, how can I best help you? But getting on either side of a person, giving them your hand, making sure that they can bend their knees and help to pull up on you, that's the best way to do it. When you pull on someone, you can actually jerk them off their center of gravity. You can also injure yourself. So it's important to think about evaluating the environment, using what's around, and just doing it slow and controlled. You can always go from being on the ground to sitting in a chair, assessing, and then standing up. If you are assisting someone who is unsteady, this is probably one of my most important slides in this talk. Assisting someone who is unsteady on their feet is something that should be done just like we used to dance in the old school ways. You put a hand around someone's waist or on the small of their back. Center of gravity and balance is best felt in the small of the back. So that's why Fred Astaire, Ginger Rogers, you used to see them dancing. They moved with grace, and it's because Fred always knew where Ginger was going, and Ginger always directed Fred as to where she was headed next. And that's because that's where you could feel center of gravity. So when you put a hand on someone's back or their waist, you can actually close your eyes and you know exactly where they're shifting. If you hold someone by the arm or the forearm, they could be falling, and if you weren't looking at them, you would never know it. And I've seen that happen with family members. I've seen that happen with trained professionals even. So it's important to understand that the center of gravity is at the small of the back. And if you are walking with someone and assisting someone, resting a hand on someone's back is the best way to sense where they are. Now, let's shift gears a little bit. Let's talk about balance. Balance is a function of three things. It's a balance of the visual input that we take through our eyes, it's the vestibular input that we take through our ears, and it's proprioceptive input through muscles and joints. All of these give feedback to the brain, and the brain actually gives feedback to these systems. So for example, if you are standing in the shower and you go to wash your hair, you're going to close your eyes, put your head back, and the water's going to run in your ears. Then you're standing in a slippery environment, and believe me, no one wants to fall in the shower. Okay? But just remember that your eyes are what tell you what's around you. They tell you what you can grab hold of. So if you have visual problems, so you're not wearing your glasses or you get something in your eyes, you lose that bit of input. You've got to depend on what you hear. You can hear the distance of the wall around you, or you can hear that there's people nearby. And your muscles and joints, and especially your sensation, that proprioceptive input is what also gives you feedback. My father-in-law, for example, having Parkinson's and having tremor and having a decreased proprioceptive input, he didn't have that ability to adjust himself as quickly as he used to. So all three of these things contribute to our balance, and balance is important to fall prevention. We use three different strategies in trying to work with our balance. For example, if you've ever been on a cruise and you're standing on the ship, you know that you're shifting your weight just in your ankles, and so it's important to have that proprioceptive ability. If you have a loss of sensation in your feet from diabetes, for example, you don't have as much of that proprioceptive feedback. Also, if you have limitations in your ankle flexibility, let's say, for example, you have a family member or you're someone who is lying down a lot and you find that your calf muscles are tight, you don't have as much feedback and function, and so making those adjustments for your balance is a little harder. Therefore, you may be someone that uses a little bit more of a hip strategy. This is where we actually adjust our hips back and forth to to have a protective sway of our balance. And you may see this a lot with some people that have maybe a wider base of support, and because they have limitations in sensation or limitations in the ankles, they may tend to be kind of hitched forward at the waist, and that helps to counterbalance what their ankles and feet can't do. If someone also may have a history of low back problems combined with proprioceptive deficits or tight ankles, they tend to use what's called a stepping strategy. And these are your patients and people that you see with a wider base of support, more bent forward, and more likely to eventually have to depend on an assistive device because your body just fatigues and it tires from hinging forward. So when I, as a therapist, am looking at someone, and believe me, if you've ever met me, you know I'm watching you walk. Just understand that from the get-go. But it's important to understand that all of these strategies are indications of things that need to change. And usually these are modifiable factors. It's easy to learn how to stretch your calves. It's easy to learn how to increase the range of motion at your hips. And this helps to decrease that base of support and to get people upright. And when you're upright, you're more balanced and all of your body systems are working effectively. This is a study that I've gone back to and I've used probably in the last 15 years of my practice. It's one of those things that really defines for a lot of people, both in physical therapy and in rehab, but also outside of rehab. These are the 4 things that can contribute to falls in the older patient. So decreased ankle flexibility, when your calves are tight and your ankles can't move, it can contribute to your risk for fall. The fancy term of severe hallux valgus deformity is bunions. So when you have bunions, you have a great toe or a big toe that may deviate towards the outside of your foot. And the problem with that is that normal walking motion is to roll through your foot, and your big toe is the last thing to leave the ground. So if your big toe is turned and you have a large bunion, that can actually change how your foot leaves the ground, and that changes the base of support. You can have decreased plantar tactile sensitivity, and that's actually a fancy term for the loss of sensation on the bottom of your foot. So if you have neuropathy, if you're diabetic and you don't have as much sensitivity on the bottom of your foot, that's one of the key reasons why wearing shoes is so important, because you can, one, be at risk for stepping on things that can puncture your foot or cut your foot and develop a wound that you don't know about, but you can also not know when your foot is on a solid, even surface. So that's where you step on a crack in the sidewalk and you can lose your balance and it can throw you. Or you can trip, and because you can't feel when your foot hits the ground, that can be something that throws you as well. And then the last thing is decreased toe plantar flexor strength. So that means as your big toe pushes down into the ground. So for example, if you have things like gout, gout is a type of arthritis, and if you have increased gout, you can lose that sensitivity of your big toe pushing into the ground and helping to control your balance. So these 4 things alone, how your foot hits the ground, is the foundation for any other movement of your body through space. And so if we can control these 4 factors, these are things that can have a huge impact. Now, the things about your balance and gait that you want to ask yourself is, have you fallen in the past year? Do you use an assistive device? Are you unsteady when you walk? Do you tend to furniture surf? Do you have a fear of falling? I mean, that again is one of the base questions that you want to ask yourself. Do you need support from something when you're standing up or sitting down? Do you have trouble making a transition off of steps or curbs? Do you find yourself rushing to the bathroom? People who are incontinent can be at a risk for fall. And I will tell you, as someone who has worked in a hospital for the last 28 years, there are a lot more people that have problems with incontinence than you would ever think of. When you're fearing incontinence, sometimes the best thing you can do for yourself is to put yourself on a toileting schedule and that's something that can actually help to decrease that feeling that you have to rush. We talked about loss of sensation, medications, and even a diagnosis of depression. These are all things that decrease your participation and can, again, contribute to problems with balance and walking. There's some standardized testing that we do as therapists, and the standardized testing, one of the great things I love is that the tests, or what we call the testing is the intervention. So when a therapist is working with you, they might work with you on balance activities, how you move, how much time it takes you to get from point A to point B. There's a test called the Tinetti. It's a balance and gait test. So it looks at your ability to stand, move, walk, change direction. It's a multiple facets of how we function and move. The timed up and go is one of the most simple tests that we do as therapists. And if a patient can, when we say go, if they can stand up from a chair, walk 10 feet away, turn around, walk back and sit down, if they can do that within 14 seconds or faster, they are at less risk for falling. We never depend on one test, so we might do different tests. There's another test called the Dynamic Gait Index that we can do with patients, and that looks at your ability to walk straight, your ability to turn your head side to side, your ability to look up and down, and also your ability to navigate over an object. And then just a sit-to-stand test. These are the type of testing that we employ because they're functional tests. They're tests of activities you do every single day in life. There's nothing that is off the table when it comes to figuring out what's contributing to someone's possibilities of falling. The main thing to take away out of all of this is mobility is really the key for everyone. People get into a cycle of deconditioning. On the upper right of this screen, you see the prolonged bed rest. And one of the things that happens is that, especially when patients come to the hospital, patients can be in the hospital, and for every day that you're in the hospital, it can take you a week to recover. And especially if you're coming in with another medical condition contributing to it. This can take people into decreased muscle strength, confusion or disorientation, constipation, which is a huge dysfunction for a lot of people. And then because of constipation and incontinence, people can then decrease their appetite because they don't want to eat when they can't go to the bathroom. You can subsequently, in some cases, not all, suffer swallowing complications, and this can lead to further immobility and further decline. So you get into this cycle of deconditioning. Now, this is not everyone's cycle. Some people may just notice muscle weakness and confusion, which are very common factors, but they may be able to kind of skip through that cycle and start to increase their activity, and that helps to get them out of it. But for the patient who's already on the precipice of decline, this is the cycle of deconditioning that can happen. So these are the things that we want to prevent. One of the things that was very apparent during COVID is that as people became more isolated, it contributed to a lot of mentation deficits, a lot of depression, and a lot of physical dysfunction for the older patient. So this is something that we are still trying to recover from as a healthcare society. We talked about these facts of deconditioning, so I just want to reemphasize that being in bed and being deconditioned, these symptoms can be rapidly they can affect a patient more rapidly than your traditional older patient. So it's important to understand that patients who are in bed for multiple days, that can increase their muscle decline. They can have a decrease in strength, and patients who may not have had an issue with incontinence can start to have issues with incontinence. So all of these factors, keep in mind that these are factors that contribute to your overall decline. So how do we combat that? Well, exercise. Everyone knows that exercise is good for us. Everyone knows that exercise is important. But I'll tell you, people come up with many reasons as to why they can't exercise. I'm too old to start exercise. People tell me I'm not safe if I exercise. I have to go to the doctor. I don't want to go to the doctor to get an exercise program. I'm too sick to exercise. There are people who are afraid that exercising might exacerbate their health conditions. And that is a discussion that you have to have with trained professionals so that you can understand the hows and the whys as to why certain types of exercise are important for you to do, even if you have a medical condition. I don't have time to exercise is actually not a reason, or you're too weak, or you're disabled, or you don't have the money. I can tell you everything is exercise. Everything you do is exercise. Someone who never leaves the house can exercise. If you clean your home, if you mop your kitchen, if you wipe your counters, if you put things up on shelves, if you fold laundry, that is all a type of exercise. These are all the things that you can do to exercise. The main thing to understand is that it's about increasing activity. One of my favorite stories about exercising is there was a patient, it wasn't my patient, but it is a story of a patient. She lived in a senior community and she walked with a four-wheeled walker, and what she did is in her apartment she had a path from one side of the apartment to the other. And so what she did is she put two small trays, and she put pennies in one of the trays. And what she would do is she would take a penny out of one tray, she'd walk across the room and put the penny in the other dish. And then she'd go back, get another penny, and she would do that back and forth across her apartment. That's how she got her walking in. It was a controlled environment. It gave her a task to do, and it actually helped her to maintain her function. Something that simple is something that you can do. If you're just doing sit-to-stands from a solid chair, that is exercise. If you are walking around your kitchen island, that is exercise. Think about all the ways, even just going outside for a little bit during the day and sitting outside or walking around an outdoor table. Those are all things that you can do to increase your activity level. Obviously, if you're more active and you're more functional and you can get out and you can go play pickleball, or you can go to the movies, or you can go on a vacation, or you can ride a bike, do those things. You stay as active as possible. It's one of the most common questions that I get as a therapist is, I'm about to have surgery, what can I do to prepare for the surgery? You do as much as you possibly can. If you can go out and walk 9 holes of golf without a cart the day before you're going to come in and have, some type of surgery, if you're physically capable of doing that, do that. That's exercise. But if you can't do that and you can't even foresee yourself doing that, then sometimes the best exercise you can do is to walk all the corners of your home, or to go outside and walk in your driveway. Flexibility is yet another type of exercise, and I think this is one of the most underrated types of exercise. As we age, one of the best things that we can do for ourselves is to maintain our flexibility. Flexibility isn't just about warming up, it's about maintaining muscle length. Every muscle in our body has an equal opposite muscle. And so if we can maintain muscle length, we can maintain muscle strength. So we focus on the major muscle groups. We want to make sure that we continue to try to maintain as much flexibility as possible. One of the easiest ways to do this is to do things like lying across your bed. So if you have a queen size bed and you sleep on one side of it, you want to lie perpendicular and use that wide strength to actually open up the chest or take the arms above the head. Because when you're lying down and you do that, gravity is going to help you. It's going to help you stretch those muscle groups. If you spend a lot of time bending forward, roll over on your bed and lie on your stomach. Even older adults can have tummy time. So that's what's really important, is you want to try to find those ways. If that hurts your back, you can actually put pillows underneath your tummy before you lie across your bed. And sometimes it's not about lying on your bed, fully 100% lying on your bed, but maybe just bending over your bed and putting some pillows to support your back so that you don't cause yourself any increased back pain. We don't want anybody to dive into an exercise program, but you also know that it's possible to recreate some stretching. This book is one of the #1 books that I have ever seen that has simple, basic, straightforward stretching. And it's literally called Stretching by Bob Anderson. It could not get any easier than that. It's a great tool to think about using. This book has been around for my entire career. You can see it's the 30th anniversary edition, and I've actually been a therapist for 30 years, so I feel like I've definitely grown up with this book. But it can be a great resource. There's so many sites and tools and people that go over just basic, easy stretching programs for people. Sit and Be Fit is still on TV, and they still teach it to this day, and that's a great way to just sit and increase your muscle flexibility. So if you can't do that repetitive lifting of weights, lifting of heavy things, just focus on stretching, because if you maintain your muscle flexibility, you will continue to maintain your muscle strength. As an example, let's talk about some muscles that you can stretch. So for example, the front of the chest. It's important to remember that certain muscle groups are tighter and therefore contribute to overstretching other muscle groups. So if you develop what's called kyphosis, meaning that your upper back is rounded, your head is forward, that can actually be contributed to because of the front of the chest. So by opening up the chest and opening up the arms, that's going to actually help you to stretch these anterior chest muscles. So for example, in your recliner chair, put the recliner all the way back, put your feet up, but let those arms open up and stretch open so that you can stretch the front of your chest. And that is then making it possible for you later to work on strengthening your upper back. By doing that, that's also going to help with your respiratory status. That's just going to help you to be able to come more upright in terms of your posture, and that actually takes a lot of pressure off of the low back. Second thing is your hip flexors. If you sit a lot, hip flexors can be tight. One of the important things that people forget is that the muscles in the front of your hip, they attach two ways. So your hip flexors help you to bend forward by anchoring at your hips, so they help you to flex your trunk forward. They also help you to bend your hip up. So when you anchor one of those 2 points, you're either going to lift your leg or you're going to bend forward at the trunk. When these hip flexors get tight, this is something that can pull you into what we call lordosis. It means that your lower back has more of an arch and your stomach can go forward. This can be also contributed to if you have a large stomach. So one of the things that you want to do is you want to learn how to stretch your hip flexors, and therefore it helps you to have more of a neutral spine, less of a curvature in your back, and you can help work on tightening up the abdominal muscles. Your abdominal muscles and your spinal muscles help to sandwich your spine and help to give it support. Piriformis muscle, it's a muscle in the buttock, and it is one of the external rotators of your hip and leg. When the piriformis muscle gets tight, with a certain percentage of patients, the sciatic nerve, which comes off of your back, that can go under this muscle, on top of this muscle, or in a very small amount of cases through the muscle, and that can cause numbness and tingling in the legs, in the hip, in the thigh. And so to get rid of that, keeping the piriformis muscle stretched can help to decompress that pressure on the sciatic nerve. It's a good practice to stretch your piriformis muscle, because most of the time we spend with that piriformis and those external rotators turning the leg out. So that means that those muscles are constantly working. And so we want to stretch them. So lying on your bed and bending your knee up and then bringing it across your body can help you to stretch your piriformis. You can also do this in sitting. For your feet, it's important to keep your feet stretched out. Many patients, many people, as they age, they collapse their arch, they develop flat feet, they develop collapsed arches and other foot disorders. And so just maintaining the flexibility of the soft tissues on the bottom of the foot is important. You can put a ball on the ground and you can roll on a ball. You can freeze a water bottle and actually roll it back and forth on your foot to help to calm down pain. Sometimes people will have pain on the bottom area of the foot, and so by massaging the bottom of the foot, by stretching, you can see the person is actually pulling up on the big toe. That helps you to stretch that band of tissue on the base of the foot, and that helps to maintain that flexibility. It's really important to remember that things like foot supports and supportive shoes are really important. If you have a shoe that is not supporting your foot, get rid of it. It's not doing you any favors. Cute shoes are not always the best shoes, I hate to tell you. Our calf muscles, this is yet another issue. Your calf muscles, you can have many reasons that contribute to leg pain. For example, many people have what's called a Baker's cyst. This is a small pouch of fluid that develops from the knee joint, and it actually can cause it can cause a bit of pressure behind the back of the knee, and this is almost like having a pillow behind your knee all the time, so it keeps you bent instead of being able to straighten it out. Your calf muscles themselves can get tight, and you actually have two large heads of the calf muscle, and then you also have another muscle underneath which can get tight as well, so you have to learn how to stretch all of those muscle groups. By increasing the flexibility of our calf muscle, that's going to give you more range of motion at the ankle, and as I discussed earlier, the range of motion at the ankle, that is critical for balance. So developing exercises, it's just about adding small things into your day. So adding in things like weight shifting, lifting the legs by bending the knees. I tend to like people to do exercises in sitting. You can start with what you can do lying down, go to sitting, and then go to standing. As you do exercises where you decrease your base of support, that adds in that balance component. So you can start with wide stance exercises, weight shifting, stepping, and then you can start to decrease the base of support. You can also do things that challenge your balance, like wand balancing. What that means is that you can take a broomstick, and the more that you hold that broomstick in the middle, it's going to be balanced. But as you change it and you start to hold it closer to one end, then you've got to worry about balancing that wand, and that causes overall body shifting. So those are things that you can be creative with. Anything that's going to challenge your balance and challenge your movement is an exercise. Walking on your heels, walking on your tiptoes. You can do things for your upper body like shoulder rolls or stretching, or just bending forward to stretch the low back. All of these are things that contribute to your overall health and function. Again, when you are going to start these exercises, don't try to add in everything at once. Start with, I would say, 2 to 3 exercises at the very most. Be consistent about those exercises, and when things get easy, get rid of them. Find something else to do. These are strength and coordination exercises. These are things that I love because they involve movement and a lot of functional movement. And this was a list that was put together years and years ago, but in actuality, it actually is still important. Things like heel and toe raises, biking, walking, jogging. You can use rowing machine. You can do things like isokinetic movement in functional patterns is actually using a device or using equipment to move in functional patterns. So that would involve going to a therapist or going to a gym. You can do resistive exercises with rubber bands or rubber tubing. Things like devices like the body blade, which is a functional movement device. That is something that you can purchase on your own and have it at home. I'm a huge proponent of the movement classes. Here in South Fremont, for example, I just went to our AgeWell facility in South Fremont, and that facility is beautiful. And they happen to have some Tai Chi classes and dancing classes going, and that's a great way to start to move better, but also to increase your socialization with other people and to meet other people that are where you are or where you want to be. So take advantage of what's out there in the community. Also, exercises that help you work on just your visual stimulation. If you find that you just can't get out and move because you get dizzy or you have problems or you're afraid that you're going to fall, start with things just in your home. And there's some, even working with a therapist on eye movement and head movement is exercise for your vestibular system. And those are the things that get you more comfortable about, starting to integrate other exercise into your routine. One of my other favorite things that I encourage people to do, especially if you have a fear of falling, is to voluntarily get down on the floor. That means that if you have a fear that you might fall, so therefore you don't want to fall, it's better for you to actively say, I'm going to choose to get up and down from the floor. This happens to be a fitness test that was devised by a Brazilian physician. And it's not to encourage people to try this, but it's to say this was something that he looked at as a function of people's strength. And so they developed a grading system. So when you get down to and up from the floor, the more points of contact you need is indicative of how little strength or flexibility you might have. The less points of contact you need, the better your strength and flexibility are. It doesn't matter that you try to score the best on this test. It matters that you're looking at how do I get up and down from the floor? And actively getting up and down from the floor helps to decrease the fear of being down on the floor. So I think that it's important to just recognize that getting up and down from the floor in itself, voluntarily, slow, controlled, with as much support as you need, is a great way to challenge your flexibility, challenge your strength, and to decrease that fear of falling. Now, let's look at some areas of your home, and let's see how you could use this for exercise. So, for example, walking around this island in itself is a great way to think about exercise. You can stand at the end of the island and you can practice exercises. You can bring up a chair with arms and do sit to stands. You can also do that between the two counters. So if you put a chair over here by the refrigerator, you can actually put a hand on the counter and a hand at the sink, and then you can sit to stand here. You have these high stools, and so high stools, you can work on stretching at the high stools. You can also use the island or the counters as a stretch point. When I used to do home health more, I would take people to the L shape in the kitchen, and that's where I would have them exercise, and that way they could put a hand on each counter. We could also practice reaching things up in the counter shelves for shoulder and arm range of motion. Outside, I look at this area. Some of you see a lush green lawn because water was not an issue at the time that I shot this. But in this area, you can see that there's a planter here. It's nice, solid brick planter. This is a great surface to practice sit to stands on. You can actually walk out here on the sidewalk. And I don't know if you can see, but there's a school ground across the street. There's a nice big parking lot, so you can practice walking around in the parking lot or just up and down the street. If you want to work on balance activities in the lawn itself, it's an uneven surface. So working with someone to walk in the lawn, you can also come out here and practice getting up and down if you wanted to practice, or you can come over here and practice that. This entry actually has a couple of stairs, so it has one to a landing and another one to get to the front door, so you can stand and do stretches from this surface here in the front. So there's a lot of things to do. You can also come out here to the telephone pole, and that becomes an anchor point where you can stand and you can work on side stretches, back stretches, leg stretches. In the backyard, same thing. There's chairs here that you can use to sit on or that you can use to exercise with. You can come over to this pony wall here and use this as a sitting surface. There's some nice higher patio chairs, and there's also some lower chairs with arms. These are all great surfaces to sit to stand on. And these pavers do create a little bit of a bumpy environment, but they also, this is a great area to just circle around in the yard, walking back and forth. Full disclosure, these are all areas of my home, and these are things that I think about all the time. When I go to the airport, when I'm at someone's home, I'm always looking at, hey, that would be a good place to do these types of exercises. The resources that I want you to take away from this presentation is that I want you to focus on finding some group classes, to participate in. There's plenty of opportunities in many cities that have senior centers. So I know that for Hayward, Fremont, Newark, Union City, we have senior centers that you can access, and they have group classes available. There's plenty of online resources now, and plenty of people that teach exercise programs. It's not about how many exercises you do, it's about trying to improve your overall physical function. You can certainly try certain things. You can just look up how to start exercising, and that's one of the best resources that you can find for beginning any sort of exercise program. As I said, Sit and Be Fit and Tai Chi, those are two of the easiest ways to get started with exercise because they don't involve anything other than just making the attempt and trying. At Washington Hospital, if you do need organized skilled physical therapy, we have two outpatient PT areas. Our outpatient neurophysical therapy, so this is for people who are lower level, who have a need for a skilled physical therapy intervention. Usually our patients that come to outpatient neuro, which is at the main hospital of Washington Hospital, these are patients who have difficulty with walking, more history of falls, injury, balance, and are not as independent. We see those outpatient neuro patients at the hospital. For orthopedic issues, for patients who are more ambulatory, looking for a little bit higher level of intervention, that's our outpatient physical therapy clinic, and that is at our Civic Center building at the corner of Civic and Walnut. So if you're not sure which one to go to, you can always ask, and we can get you referred to the right one. Again, there are massage therapists out in the community that you can also visit. Sometimes the best thing you can do for yourself is to get a massage. It helps to loosen you up. It helps to kind of get things started. As you are more mobile, more functional, there's a multitude of gyms and senior centers that are available. I was actually just at just this weekend, I noticed that there's pickleball courts now next to the library, behind the library. They've added pickleball courts. So now that's just another resource for people to get involved and start doing things to get moving. And most importantly, there's apps and games and things that you can do to work on your balance, to work on your flexibility. Even something, like if you remember the Apple Wii, that was a video game that was all about a board and all about balance, and even something like that, is beneficial. And we even use it in the therapy setting to work with patients on getting movement and figuring out where their deficits are. You can go from the most expensive and complicated things like buying an elliptical trainer, buying weights, buying a bike, resistance bands. You can get all sorts of things for your home environment, but if you don't have those things available, or you don't have the ability or the money or the space to do things like that, you can use what you have. You can use towels for grip and working on grip strength, and you can hold a towel around a pole, or you can figure out some ways to use items in your home. You can hold on to your doorknobs, and you can stand and you can balance, or you can hold the door frame. You can use couch cushions to work on balance if you're, if you want to look at how you adjust your balance. You can use grocery cans or grocery bags with cans in them for weights, and create your own weights. And by all means, your own body weight is your best exercise tool. Do not try to start an extensive balance program with no one else around. Always let people know that you're starting some exercises. Do them with someone else so that they can watch you and they can help you. But it's important for you to start thinking about how you can try to make small changes in your lifestyle to affect that bigger change. So remember, you can start exercising in the recliner, on your bed, in your guest room, using a dining room chair or patio chair. You can practice getting up and down from the ground next to furniture. You can work in the kitchen, on an open floor. You can go outside on the porch. You can use stairs. I always say use the bottom 2 stairs because that's always the safest. You can get out into the yard or in the driveway. All of those places count as exercise areas and are very effective for you. Okay? My final points are be proactive. Take an active role in your health. You don't have to start perfect. It's okay to start with something. Start with what you can and you work on getting better. Okay? If you know someone who is suffering from physical problems and limitations, there's plenty of healthcare professionals out there to help. Remember that physical therapists, even if you've been to physical therapy before and maybe it wasn't the greatest experience for you, there's other physical therapists. If you ever have trouble finding physical therapists, you can literally look up physical therapist outpatient clinics in the community. And as I said, we have 2 wonderful physical therapy offices here at Washington Hospital. Also, check in with your physician. Let them know where you are and what you're doing. We want to make sure that everyone has the guidance and the guidance of a healthcare professional to help them pick and choose what's the best exercise program for them. You don't have to start with anything extensive. 1 or 2 exercises works out just fine. And most importantly, remember that the most important free resource that you can have is a pharmacist to assess and reassess your medications, how they interact with one another. That has a huge impact on your ability to participate and to be safe. In closing, I would like to say thank you. Please take care of yourselves. Please think about getting active, trying things, new things. Just remember, start with one thing and go from there. Thank you very much.
Thank you, Alisa. We do have just one closing question. Is it ever too late to get stronger for someone who has not been active for a very long time?
No, it is never too late. My favorite stories about patients, one of the reasons that I got into geriatrics as a specialty, we had a patient who was 88 years old. She was having joint replacement surgery. She insisted that she was going to have to go to a nursing home, and which required her to stay in the hospital for 3 nights for Medicare. Well, the first day after surgery, this woman was walking around with her walker in the hospital with someone. By the afternoon, she was walking around by herself with her walker. By the second day, she was dressed in her little blue dress with her little black shoes and her little black purse, and she was walking around the facility. And, you know, that was just an epitome of someone who had taken the time to take care of herself. She was 88. She did yoga 4 times a week. And so age is never a factor as to why you can't participate. It's really about starting with what you can do, making what's called SMART goals, specific to your situation, that are measurable for you to know that you're making progress, that are attainable goals, things that you can do. Don't make them so difficult that you can't reach them. Make small changes that are relevant to what you want to do. If you want to be able to get out to the movies, if you want to be able to go to a shopping mall, if you just want to be able to go over and visit family. And then T is time-based. So set a time limit that you want to reach that goal by. So in 1 week's time, you might just want to be able to walk 1 city block and back, and that's relevant because the house that you want to go to is down the street. That's how you start. So it's never too late to start.
Thank you, Alisa. This does conclude our program. And thank you for this insightful presentation. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.